Hi guys, this is a part three of the healthcare reform, and I want to make a few suggestions, proposals. The first one is that based on the question, the problem that we have, that the first one is to have insurance carriers, health insurance carriers, to have some kind of agreement or treaties, so they can handle some mistakenly shifted the patient to different to the wrong address, wrong ICU, wrong hospital. That way, and especially for the case that some people they're living in one state but it's very close to another state, or the other state is more resources, those kind of things of that nature. So it's inevitable, almost inevitable to see that this kind of accident being wiped away completely. There will be some mishaps. So we might as well just put some measures in place and then have some healthcare insurance carriers to have some treaties. You treat some of my patient, I treat some of your patient. So obviously no more than 10% of all the patient decline, all decline pool. So that's kind of thing. That means that even sometimes someday somebody was mistakenly sent to a wrong hospital out of a network, the other guys can pick it up without having seen a hospital bill that is more expensive than the house that they have. So that's one suggestion. Another suggestion is that it's not a completely new, because right now we do have some supplementary coverage. We have a primary healthcare coverage, but we also have supplementary coverage that like things like this nature, like hospital indemnity coverage. Hospital indemnity basically means that you, once you're hospitalized, the insurance carrier will give you some a certain amount of money each day you stay in the hospital, and then that's it. Okay. But and then we also have like accidental illness, critical illness. So that will basically that are designed in place to design it for some people to have the coverage when things that they are not foreseen, they're not predicted, just happened by accident, by mishap, or whatever. And then in that way, by paying a little bit extra premium, so you can have a peace of mind. So the basic idea is the same. The insurance is always still working on people's fear. Okay, everybody's afraid of dying. Everybody's afraid of a severe sickness. So that's why they want the insurance. The insurance will buy them peace of mind, partially. Okay, at least. So if we can allow people to buy actual coverage, supplementary coverage, and then that would be uh, give them peace of mind. The key, of course, is that you have to have enough. The bigger the pool, the more people are willing to buy it, the better, right? So because in a way, the insurance is all about one part of a patient is subsidizing other client. Okay, the subsidies, mutually subsidies, like that's how the like socialism works, right? So this kind of idea, so that way if you have a accidental illness, whatever, end up in ICU, let's say your insurance policy, normally your primary insurance coverage only cover you 2 days or 1 week at the most, right? That happened the last time we had there's one case that one lady, her husband is in a coma. So the insurance only allowed them to stay 2 days, and then the insurance plans are trying everything, try to get the get their husband out of a hospital as soon as possible. But because the husband is in coma, so they can't really do that. So in the future, you should have something allowed by encouraging people buy supplementary coverage, pay little premium. The detail of plan will depends on your health history, your health status, your age, those kind of things. We'll work out something, but the idea is that a lot of people buying the supplemental coverage. That way, we can say your hospital stay will be extended from 5 days or 2 days to 2 weeks, whatever, right? And ICU stay from 1 day to a week. Those kind of things of that nature. Again, the same idea is that we take advantage, we leverage people's fear, the fear that people are scared that they, someday for no, out of nowhere, for no reason of their, no control of their own, they end up being sick and they don't want to be kicked out of the hospital. Speaking of the fear, I really want to say something that, I've been thinking about this question that what is the American that has done, the US has done right, that the European people are not doing so well? The result is in the per capita GDP. The US, the per capita GDP has been up and up, and basically leaving the European far and further behind. Okay, I remember this time I watched that the Vice President J.D. Vance was, giving the European people a hard time. But in the end of at the end of the day, I mean, you really have to depend on your power, your resources. America has more resources. We have more resources than the European have. So, what is the reason? What drives the American be more resourceful than the European? I think one of the key is that in America, in the U.S., everybody struggles to get something that they want. But in the European, many European countries, they have like one good example is universal health coverage. They are very proud of it. But once people are know for sure that they don't have to struggle, they can get it either way. Everybody has a coverage. We have all kinds of problems. We don't want to try that hard. We don't want to. We have a certainty. We know things will be there that we don't have to struggle for to get it. So that kind of thing, the people lowers down people's ambitions. You know, so that's something that I really want to do. That's why, for the same reason, I haven't said much about the Trump's reform, right? I think of some people saying that Trump and Musk are doing like a Chairman Mao is doing for cultural revolution, right? I think what they're doing is kind of still meaningful. Don't look at it completely negative, right? I know that the changes, not people usually don't like to see changes. Changes can be painful. On the other hand, that's just another thing that makes Americans strong is that there's an always struggle. Everybody struggles to get at where they are. One example is that the government, federal government, state government, the employees are relatively, because they know they have a kind of a relatively easy life than the private sectors. Okay, their their benefit is good. Their job is not demanding, and then nobody can, you know, force them to be working as hard as the private sector. So that kind of thing, when you have that kind of the complacency, the things are starting getting worse. So I kind of understand that some changes they're doing, even though some changes, particular changes, it's not always accurate. For example, we talk about the Social Security, and one guy was just pointed out that Elon Musk was saying that the Social Security, we have so many people like 200, 300 years old. But that's just the program, that the old program that didn't have a decent handover date. So artificially entered some random numbers, but social security does it mean that the social security actually pay all the people like 200, 300 years old? I don't think so. I think that's the case. But either way, it's just something that make everybody make that the stability. Not at least not make some instability, some kind of instability. It's good. Okay, changes are good, good for the country in the long run. Okay, so that's kind of a thing that I want to say it.